Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper lateral incisor, upper left lateral incisor, where you can very clearly see we've got an implant placement with very severe bone resorption and slight cortical bone expansion on buccal as well as on the parietal aspect. This is the sagittal view. So here you can very clearly see we've got this is the area where we have the infection around the implant. This all the way here. As you can very clearly see, this is a 13.9 by 13.8 millimeter measuring lesion. The red marks the area of the lesion and the measurement. You can also very clearly see here that we've got loss of parietal bone, loss of buccal cortical bone, and there's expansion here in the remaining buccal bone. This implant at this point does not invade the floor of the nasal cavity, but definitely, as you can very clearly see, the entire infectious area is very closely associated. The other thing that we've also noticed is that there is a incisive foramen infiltration right here. So this is the incisive foramen right here. This is the infection, which is also now involving the central incisor on the upper left side, and here you can very clearly see that the lesion is in communication with the incisive foramen, and the incisive foramen eventually then drains into the nasal cavity. So this is where we can actually measure and mark the entire lesion traveling from the pre-maxilla into the floor of the nasal cavity. This is the anterior region. Here you can see in the coronal view that the lesion definitely involved the central incisor, the lateral incisor implant, and the canine on the upper left segment. Thank you very much. This is the axial view or the top to bottom view. Here also you can very clearly appreciate that this is the lesion and the implant is at the center of the lesion. Thank you very much.